Because patients with circulatory shock are very unstable, medicine plays an important role. Your patients with cardiogenic shock may require dopamine or dobutamine to increase contractility of the heart and support blood pressure. Norepinephrine will constrict the vessels and increase blood pressure also. If none of these options work, you can always count on epinephrine to increase mean arterial pressure, cardiac index, and stroke volume. For cardiogenic shock, diuretics are also important since these patients have a lot of peripheral edema. Distributive shock is different since infection is taking over. These patients need antibiotics like nafcillin or ceftazidime, depending on what strain of bacteria the patient is growing. These patients may also need corticosteroids like hydrocortisone to boost the immune system and decrease the response to stimuli. Sometimes vasopressors, like vasopressin, can make a big difference for these patients who need augmented blood flow to their brain. Dopamine and norepinephrine can also accomplish this task. The focus is also on infection for patients with septic shock. Besides the vasopressors, antibiotics, and corticosteroids already mentioned, these patients also need isotonic crystalloids. Those are meds like normal saline or lactated Ringer solution. These will restore interstitial and intravascular volume. Albumin can also help plasma volume expansion and maintain cardiac output. Unfortunately for patients with obstructive shock, there are more procedural options than pharmacologic. Dobutamine is the only thing that may help decrease afterload and boost cardiac output.